The rat, an innocent creature, but the deadly plague had entered the human body through the body of a rat. Plague emerged as an epidemic disease in the Middle Ages, though it had existed since ancient times. In Asia, Africa, and Europe, plague had taken many lives for hundreds of years. However, that is now history, and the microbe of plague is now a topic of research in the laboratory. But even as the world is moving forward, more dangerous new viruses are coming out and becoming a huge threat for the human civilization. Global health is now under an ultimate threat due to the attacks of deadly viruses one after another. The attacks of Ebola, Zika, bird flu and swine flu, MERS or HIV viruses have become a fact of ultimate panic. Infected with these viruses, thousands of people die every year, which causes severe panic among the people. Ebola is named after the Ebola River of Congo. In some countries of Africa, Ebola is spreading rapidly as epidemic-like river waves. The governments of Guinea, Sierra Leone, and Liberia have been forced to declare a state of emergency to combat Ebola. The discoverer of Ebola virus, Professor Peter, said in an interview with CNN,
"Well, Ebola virus infection starts with, something that looks like the flu. Headache, fever, maybe diarrhea. But then you can develop very fast bleeding that's uncontrollable, and that's how people die, although not all of them, 80–90%.
The World Health Organization, WHO, recently issued a warning about the possibility of epidemic spread of Zika virus. The virus has already spread out in 20 countries of the world. This mosquito-borne virus is named after the name of Zika forest of Uganda. The Brazilian president, Dilma Rousseff, has urged Latin American countries to unite to confront and encounter the virus. The World Health Organization fears that about 3 million people could be infected with the virus this year. 1.5 lakh people have already been infected by Zika in Brazil. A few years ago, bird flu caused extreme panic in Southeast Asian countries. It is a contagious viral disease. People who are involved with poultry industry may be infected with the disease. Moreover, this flu could spread from the infected patients to other people also. On the other hand, like the influenza virus, swine flu is another kind of virus which can grow very easily in the pig's body. Because of the similarities in the genetic feature of human beings and pigs, this virus may spread more rapidly in human body than that of bird flu. The danger of HIV infection is no longer unknown to anybody. There are 7.5 million people around the world who are carrying the HIV virus. HIV has spread to all corners of the world, but its intensity is much higher in African countries and countries surrounding the Sahara Desert. Another deadly respiratory virus is MERS, which was first detected in Saudi Arabia in 2012. MERS is a powerful member of the SARS family. Infected from SARS virus, which comes from the body of bat, almost 800 people died around the world. Many people have already lost their lives to these infectious viruses worldwide. According to medical experts, as long as the antidotes of these viruses are not invented, several steps to prevent these deadly viruses must be taken. There is no antidote. The global health is at risk. What to do in this situation?
Actually, yes, of course, there is no antidote, but it is not a hopeless situation. We have faced this in the past, and we are going to face at the present, even in future, by taking simple precautions like washing hands, protection clothes, protection masks. I think we can contain any viral infection and viral epidemics to a certain extent. So if we can take simple measures on public health, till we work and find a vaccine, we can protect our population. So it is not a hopeless situation. You have to take a measure to contain this.
In this global health issue, the Asia-Pacific region has become a part of the fight for preventing the risk. Different activities are carried on by public-private sector on a regular basis to develop prevention measures. As a part of these activities, a seminar entitled The Global Health Risks, Not Panic, Take Prevention was recently held at Dhaka Community Hospital.
I think it's important to remember that very simple measures have been effective in preventing the transmission of many infectious diseases, Ebola, HIV, Zika virus. So even though there's no antidote, very straightforward use of universal precautions, whether it's masks, gloves, other protective equipment, can be very effective.
The medical experts believe whenever the antidote is discovered, we should not wait for that, and we must give our maximum effort to develop a system for preventing the viruses. In this situation of fragile global health, it is not time to panic, but to build the prevention system, and that is the only way to salvation.